Common causes of swollen ankles and effective relief methods. Is the swelling in your ankles and feet bothering you? It's a common and often frustrating problem, especially among older people. And the reason behind it can sometimes depend on your age. When your feet swell, it can be tough to even get your shoes on. Abnormal buildup of fluid in the ankles, feet, and legs can cause swelling. This fluid buildup and swelling is called edema. Painless swelling may affect both legs and may include the calves or even the thighs. The effect of gravity makes the swelling most noticeable in the lower part of your body. A person may experience swollen feet for several reasons, from hot weather or pregnancy to serious health conditions such as heart disease or a blood clot. Treatment depends on the underlying cause. If you've ever dealt with swollen ankles or feet, please share your experience in the comments below. This list isn't in any particular order of priority or frequency, just our top 10 common reasons. Top 10 causes of swollen feet and ankles. 1. Trauma. This is pretty straightforward. If you sprain or break your ankle or foot, you're going to have swelling due to inflammation and potential bleeding, and gravity will cause that fluid to pool downwards. This is a very common cause. Use the Rice method to relieve pain and inflammation and speed healing for minor injuries. Limit activities for at least 1 or 2 days. Avoid putting weight on or using the injured joint or limb. Apply an ice pack to the injured area for 20 minutes, 4 to 8 times per day. Do not apply ice directly to the skin of an injured area, open wound, or surgical. Use a thin cloth to protect the skin. Keep pressure on the injured area. An elastic bandage works well. Do not wrap the bandage so tightly that it cuts off circulation. Elevate the injured body part on a pillow above heart level. Do not immediately use heat after an injury. Heat may increase the risk of inflammation and swelling. You can use heat later to relieve and relax tense muscles. 12. National Institute of Arthritis and Musculoskeletal and Skin Diseases. Sports injuries. Diagnosis, treatment, and steps to take. If you haven't injured yourself but your ankles are swollen, you might ask, am I pregnant? Pregnancy is a frequent cause of swelling for many reasons. There's generally more fluid retention in the body during pregnancy. Additionally, the growing baby puts pressure on a large vein called the inferior vena cava, which brings blood back to your heart. This pressure, especially when standing or lying on your right side, can cause pooling in the lower extremities. That's why pregnant women are often advised to sleep on their left side to reduce pressure on that vessel. On a more serious note, though less common, conditions like preeclampsia and eclampsia during pregnancy can lead to severe fluid retention and protein in your urine, which can be very dangerous. While everyday swollen ankles in pregnancy aren't an emergency, if these more serious conditions are the cause, it is an emergency. Get it checked out immediately. Home remedies. To treat swollen feet during pregnancy, a person can elevate their feet where possible. Wear comfortable and supportive footwear. Avoid standing for extended periods. Staying cool, avoiding salt, and increasing water intake may help reduce fluid retention. Wearing supportive clothing, such as tights or compression stockings, can also reduce discomfort and help the swelling decrease. Third, side effect of medication. Medications can have many benefits, but they also come with side effects, often listed right on the bottle or in the information leaflet. Many common medications can cause fluid retention, including steroids, anti-inflammatories, anti-diabetic medications, antidepressants. It seems like all the anti-medications cause swelling. You have to weigh the benefits of the medication against its side effects. Sometimes, You even need one medication just to manage the side effects of another. Anyone who thinks that their medication is causing their feet to swell should speak with a doctor. They may recommend altering the dosage or prescribing a different type of medication. 4. Infection. An infection in your foot or ankle will definitely cause swelling. Inflammation is a classic sign of infection. The area will be red, hot, and swollen. That swelling, along with pain and redness, can be a clear indication that an infection is brewing. 5. Venous insufficiency. Our veins have one-way valves that help blood flow back to the heart, preventing it from pooling. Over time, or due to various medical reasons, these valves can fail. When they do, gravity causes blood to pool in your lower extremities. This is why I'm wearing compression socks right now, thanks to Dr. Bev Chan, who did a great video with us on varicose veins and compression socks. 6. Blood clots, DVT. You might have heard of a DVT, deep vein thrombosis, or venous thromboembolism. This is when blood pools and clots in the veins of your leg. You might have certain conditions that predispose you to clots, or they can sometimes just happen. An arterial clot can also prevent blood from leaving your lower extremities, leading to swelling. Blood clots can cause acute swelling and, over the long term, can even lead to chronic venous insufficiency. 7. Lymphedema. This is a very debilitating condition that probably deserves its own dedicated video with an expert. Our bodies have a system of channels that carry extra fluid called lymph. If these channels fail, are absent, or get damaged, for instance by radiation or surgical removal during cancer treatment, fluid can pool outside its normal pathways, often in the legs, usually on both sides. This is a very challenging condition to manage. 8. Heart failure. Often called congestive heart failure, CHF. This occurs when your heart, which acts as a pump, isn't efficiently circulating blood around your body. If your heart pump is failing, it can't move blood effectively away from your extremities and back into the central circulation. This causes fluid to pool and swell. A key indicator of swelling due to heart failure is that it typically affects both sides, both ankles. Unlike trauma or infection, which are usually one-sided, heart failure leads to bilateral swelling. Your heart has two sides. Left-sided heart failure usually causes fluid to back up in your lungs, but if it progresses to affect the right side, that's when you see fluid pooling in your extremities. 9. Kidney failure. Our kidneys are vital for managing our body's fluid volumes and electrolytes. When kidneys start to fail, a common problem often related to diabetes and high blood pressure, the body retains excess fluid, which ends up in the legs. Swollen ankles can be an early sign of kidney failure, or a sign that your blood pressure isn't well controlled, or even indicate a serious condition requiring dialysis. 10. Liver failure and malnutrition. Your liver plays a critical role in managing the proteins in your blood, particularly albumin. These proteins help balance osmotic pressure, which keeps fluid inside your blood vessels. If you have liver failure, your body can't produce enough albumin, leading to fluid leaking out into tissues. Similarly, malnutrition can cause protein deficiency and low albumin levels, also leading to fluid retention and swelling. So, liver failure and severe malnutrition can both lead to swelling, often in both legs. So, there you have it. Many different reasons why your feet and ankles might be swelling. First, try to gauge how significant the swelling is, how long it's been present, and how serious it feels. If you're concerned, you should definitely talk to your doctor or another healthcare professional. You can go in armed with some ideas of what might be causing it, noting whether it's one side or both, which can help your doctor make a diagnosis. But please, Always seek professional medical advice for this condition. We'll be doing a follow-up video on treatment options soon. If you're battling leg swelling, leave a comment and let us know your experience. You're 100% not alone. If you like this video, please give it a thumbs up, subscribe to our channel, and remember, you are in charge of your own health. We'll see you next time.